welcome to this edition of I'm Not Crazy But with Dr. Rhonda Mattox. I'm Dr. Mattox, triple fellowship trained, board certified psychiatrist and family. Today, we are going to talk about a subject. We're going to talk about when woke is not good, when we are up all night and don't want to be. Today, we are talking about being sleepless and not appreciating it, being sick and tired of being sick and tired. Do you know what I mean? When you are trying to go to bed, you're looking up, you're counting sheep, you're counting stars, you're counting everything, and you cannot go to sleep. So, family, today we're talking about fatigue, about being tired, and about what some of the common causes of of those conditions can be. We are doing that with an all-star cast. Now, before I introduce our all-star cast, you know what to do. Rep your city. And if you already know that you have questions, go ahead and get a head start on everyone and drop your questions in the chat so that you can have your questions answered first. Now, I will begin with my very favorite director of productions, and my producer, former therapist, Ellis Dean. You all know him and love him. And then I will also mosey on over to Dr. Sherry Diamond, who is a family medicine doc who has been practicing for about 2 decades now, even though she looks quite young. And then my newest, dearest colleague that I have just recently familiarized myself with, courtesy of several recommendations from child psychiatrists, and that is Miss Christina Allen. LPC, and founder of Passion Unlimited Counseling and Flip Your Marriage. So thank you all for joining in. I always like to get us on the same page when we're talking about a particular topic by leading with what does it mean to have insomnia, or what's the definition of insomnia? And Dr. Diamond, because you are on the stage as a family medicine doc, I think we'll start with you.
Okay, so insomnia, basically, it's a sleep disorder that is characterized by not being able to fall asleep or stay asleep. It's just that simple. You have trouble falling asleep or staying asleep. And so you can have what we call initial insomnia, which is the falling asleep. Sometimes people wake up, they fall asleep just fine, but they wake up in the middle of the night and can't get back to sleep. That's middle insomnia. And some people just wake up too early. It's not time to get up. They just, 4 or 5 hours later, they're up and they're up for the rest of the day. And that is terminal insomnia.
hmm Absolutely. And one of the reasons that I wanted to talk about insomnia is because, as a psychiatrist and a mental health professional, that is one of the areas that people are willing to see me for. And they may not be willing to see me for depression or anxiety or bereavement or grief, but many times they will be agreeable to seeing someone for insomnia. And what a lot of people don't realize is it's bi-directional. Number one, you not being able to get to sleep can contribute to mental health stuff. And then you having mental health issues can also impact your ability to go to sleep. All right. So, as we're
Right.
talking about insomnia, what are some of the, sometimes people don't think it's a big deal, but why is it important to, if you're unable to sleep for a prolonged length of time, that you get treatment for it, whether it be with a mental health professional or a family medicine doc or what have you? Why is that important? Why is it significant not to let it linger?
Well, sleep is a time where our bodies have a chance to restore. There are processes that are going on with regards to the way that our bodies deal with certain just day-to-day issues that we have to deal with. And so without that restorative sleep, it can disrupt the other processes that need to work efficiently during the day. And so, depending on the cause of the insomnia, you can have issues like diabetes. You can have obstructive sleep apnea. You can have all these different things that wind up playing into the way your body just works. Just the way that it is able to handle the things that it has to handle.
Absolutely.
So we
And
need sleep. Look, God rested. We need rest. We don't have to have permission to rest.
duly noted. That's a great point. And I will say, I've rarely met a person who is not sleeping for a long time who is happy. Maybe every now and then, and
Mhm.
some bipolar patients who are manic, but it's rare. What do you all see as mental health professionals in people who have trouble with sleeping, other than being grumpy Smurfs?
I think one of the things that contributes is a lot of stress. So if you're dealing with a lot of stress, that can affect your sleep. I know when Dr. Diamond was talking about either waking up in the middle of the night or waking up too early, I'm like, are you talking about me? Because I'm like, I have both of those issues, but I also know that because I have those issues, it has played into depression and anxiety. I mean, that's something that
Mhm.
I've dealt with personally. So I know if I'm not getting sleep, something's not going right for me. And I know how important it is to get that sleep so that I'm functioning throughout the day. So stress,
Mhm.
definitely, and that's probably one of my issues. I don't manage that stress the best way. And that's why I encourage my clients. It's like and I say we've got to figure out a way so that we can get some sleep at night. So I,
Right.
I think that's a big factor is when you're dealing with stress, you're dealing with the kids, you're dealing with lots of things. But if you're not sleeping more nights than you should, if you're not sleeping, then it looks like over the course of, a couple of months, you're not getting that sleep. That is going to impact you.
Hmm.
Mhm.
Absolutely.
Mhm.
Ellis,
Yeah, I
did you
think
want
it,
And it will impact how you are able to even function. I mean, sometimes I have patients that come in and they have certain medical problems. They're not sleeping well enough. And because of the day-to-day stresses in life, that's one of the things that I will want to address first. Like, we've got to get you to sleep because this
Mhm.
this stressor that you are under right now is not going away. And so sleep is one of our ways that we cope. It's a time for your mind to rest. And if your mind isn't resting, you're not going to be able psychologically handle even the medical things that you have to deal with.
Right. And I think
absolutely?
having sleep hygiene is extremely
Mhm.
important, like getting a routine. I go to bed every night at 10 o'clock. So I make sure that I get enough sleep, things of that nature. If you're waking up all night, you might want to go to bed at 8. So you can get, instead of waiting till 11 or 12. So sleep hygiene and just having a routine sleep habit is important.
Oh, you all have introduced so many good nuggets. So, first of all, let me just say, as it relates to some of the things that happen, if you're not sleeping, it can definitely mess with your memory, and you
Mhm.
just have trouble paying attention and staying on task. But the other
Right.
piece is you are more at risk for accidents, for driving accidents, for
Mhm.
being present at work but really not delivering. Now, Ellis, you're on with three women, and so, darling, you better hop on and jump in. It's like playing double dutch. You better jump in when we take a breath, okay?
it's all good. It's good stuff. I would also add that those of us, particularly those of us as we get older, we tend to add on some extra weight that we don't want to have.
Mhm.
And if you're not sleeping properly, it's going to impact that process because you need
Mhm.
sleep as a component of a good, healthy routine. And so you've got to eat. It is like we eat. You got to eat properly. You got to move. That's that exercise. You've got to think that's reducing your stress levels, and then you have to sleep. So there's four parts into that getting healthier process. And so sleep is a component of that. So if you're not sleeping fully throughout the night, you're not getting that good REM sleep, which is that rapid eye movement that has to happen at least twice per night, which is why they say adults need at least 6 hours of sleep per night because that takes you through that REM cycle twice. Releases those toxins. That's why you have that strong yellow urine in the morning because your body's flooding out those toxins. If you're not sleeping, you're not getting rid of those toxins. They stay in the body, and that's going to disrupt many processes, even that weight loss, getting healthier process.
Right.
Absolutely. Oh, there were so many nuggets there because here's the thing: if you're not sleeping, if you're not sleeping well enough, your body produces some extra cortisol or stress hormones. And then that's contributing to weight, right? And if you're not
Mm-hmm.
sleeping, when you're up all night, guess what you're doing? Up all night, you're munching while you watch TV and those kinds of things.
Mm-hmm.
Now, before we get too far in, I do want to talk about sleep hygiene. But before we go there, let's talk about what some of the reasons why we're not getting sleep. And you all already kind of jumped in with some of the stress and perhaps being overweight or obese. What are some other reasons why people don't get a good night's rest?
Newborn babies.
We'll talk about it. About it. Yes, yes, what she said. No, and I'm a little bit and toddlers who come in and wake up and have nightmares. Oh yes, Christina, you hit it. You nailed it right there. New mothers
Yes.
are definitely at risk. More.
Hmm.
Keep talking.
And with new motherhood, the good thing is you do have at some point hope that that the baby is gonna sleep through the night, and which will help you sleep longer. But all babies have different patterns, and so that may not come. My first two babies were textbook. At 2 months, they were sleeping through the night, and it was great. But my third one was not.
Hmm.
And it took her longer to get into a regular pattern. But just the issue of becoming a parent and
Hmm.
all of the concerns and worries that go along with that. So even once your babies are sleeping through the night, it just brings on a whole other set of issues that that have your mind kind of going at
Hmm.
nighttime when you should be resting. And there's always a list of things to do and and so I tell people a lot of times, get that stuff out of your head and onto some paper, so you're not trying to go through the night, thinking about all the checklist of things you have to do the next day as it pertains to
Right.
that child or work or whatever it is. And so,
Hmm.
you worried about not forgetting it. Well, just take a minute, write it all down so it's on paper. You won't forget it because you've written it down. So you can go ahead and go to sleep.
Right. And we call that the
True.
brain.
I could
Go,
sign off
go
right
ahead.
now.
You go.
I could sign off right now because that's the tip I needed. Because like that's the reason why I stay up a lot of night. It's like I'm
Yeah.
going through what I did that day, what I didn't get done that day, what I got to do tomorrow, what are the challenges, and you start just ruminating. And so I saw somebody put in the comments about watching TV, and it's very very bad. You're absolutely right, but that's one of the bad habits that I developed is turning on the television because that helps me stop my mind racing about that other stuff and I could just
Mhm.
focus on whatever foolishness is on TV, and that helps my mind settle, and then I'll fall asleep, but then the TV is still on because I fell
Yes.
asleep, and so that's a bad habit. But I think that writing things down, having a little notepad next to the bed, will help me clear my mind. Because when it's dark and I'm still awake, it's hard to fall asleep because my mind is still racing and still thinking about this, and
Absolutely.
or I'll wake up early
Hmm.
because
Right.
I, I didn't go that deep, and so it's definitely a challenge. So that I think that's a great tip to have.
Mhm. And we call that brain
Yeah.
dumping. It's when you keep a a journal by your bed so that because it takes more energy to say, "Oh, I hope I don't forget this," than it does to just write down whatever is plaguing you. I even do that when it comes to like sometimes when you're trying to pray before you go to bed, and then as you're trying to pray, everything pops up in your head. Well, I just write write down what's popping up in my head so I can circle back to that. But that I will also say that having the sleep mask, oh my gosh, that is wonderful. And then there's certain beds that you can buy that will lift you up just a little and keep you and perhaps reduce your risk of snoring and those
Hmm.
kinds of things. So there's some subtleties or whatever. Certainly, if you have not already put a TV in your room, let me just tell you, don't. Don't do it. Let the bedroom be for sex and sleep. All right.
And sleep.
Oh my goodness.
Feeling a little hypocritical because my husband would not live in a house without a TV, but I can tell it to you all who are contemplating. Okay, now I want to go back to some of the reasons that we're not sleeping. We looked at weight. We looked at new motherhood, stressors of new motherhood. What other types of things? And are there, what other types of reasons, medical conditions or other inner workings that keep us from sleeping well through the night or have us really tired the next day?
I'll just add, and you know, I work with couples. One of the things that my couples bring in is that they argue for hours. They argue all night long. And it's like, why would you stay up to argue? And so I just recommend, it's like, you know, that saying that you don't go to bed, you know, don't let the sun set with, you know, anger or, you know, frustration. I'm like, if y'all don't go to bed, go to bed. Talk about it tomorrow. Let it, you
Mm-hmm.
know, relax and calm your mind so that you'll be able to be refreshed and not say something that you don't mean in an
Oh,
argument.
God. That is so. What you're saying is interpreting a biblical scripture. Don't let the sun go down on your wrath or your anger.
Hmm.
Is impacting couples, and so if you are that couple, you have my permission to call a truce and identify a time when your emotions are not overrunning and you're likely to say something mean spirited, and you
Mm-hmm.
can just take a time out and circle back on a time, an agreed upon time when you all can be more level headed, clear minded, and not say things that are going to adversely impact your marriage,
Hmm.
i.e., call somebody and want to kick somebody in the throat. Okay. So that's really good.
Right.
I, I saw someone also put pain. Yes, if
Hmm.
Yes.
you if you have uncontrolled pain, that can certainly impact it. Uh, Ellis or Dr. Diamond, anything else you want to add?
Yeah, chronic pain is a big one for not sleeping. I will tell you, so going back to obstructive sleep apnea, that's another one that is underdiagnosed a lot of times. And I will have people that will say, patients come in and they say, "Oh no, I sleep. Oh, I sleep all night. I'm getting 7 hours of sleep, but it's not efficient sleep."
Hmm.
Mhm.
And again, back to what Ellis was saying, having being able to go through the getting into the REM sleep, that deep sleep, being able to cycle through the normal sleep pattern that you're supposed to be able to. Um, Sleep work disorders. I'm losing my terminology here. But
Shift
people that
work.
have to sleep. Hmm?
You talking about shift work if you're working
Yeah,
and
shift work. I'm
mhm.
sorry. Shift work disorders. People that have to work all night and they work through the night when it's dark outside. That's when your levels of melatonin that help to facilitate you getting to sleep are actually trying to rise, but you're having to fight through that. And then it throws you off during the daytime because then you go home to a house that's lit up by the sun, by
Mhm.
daylight hours, and your melatonin levels aren't going to be as high. So you even, once you get home, you may be just exhausted and really fatigued and tired, but can't get to sleep. So shift work is an issue. Some other chronic disease processes come with a certain amount of fatigue that come with those, outside of pain, diabetes, heart failure issues. Sometimes people cannot lie flat when they have congestive heart failure because they feel like they're smothering, like there's
Mhm.
heavy weight on their chest. And so, that disrupts sleep. Arthritis,
Yes.
shoulder problems. I see a lot of people that don't sleep well when they have shoulder problems.
Mhm.
Um,
I had neck pain. No, I had neck pain,
yes.
and I had a compressed, vertebrae in my neck, and I couldn't lay down. And you had to get the right
Mhm.
pillow. And if you laid too much
Right.
on one side, it was painful, and it would wake you up, so you couldn't get that deep sleep. There was and just for men that might be watching, if you're talking about sleep apnea, it becomes problematic if your neck circumference gets over 17 inches. So I think
Mhm.
it's 17 inches for men, 14 inches for women. So if your neck is around, if you measure it around and it's larger than that, then you're in that kind of zone for developing sleep apnea, and then that can have impact on your heart health when you have sleep
Mhm.
apnea. Your high blood
Mhm.
pressure, it can have an impact on that.
Lungs.
Um,
Mhm.
lungs, all of that. And so, really, I would say if you are in that range, there's places where you can go and get a sleep study done. So
Mhm.
if people tell you you're snoring, and you're stopping breathing throughout the night, and you do
Mhm.
that, and you start breathing
Mhm.
again, that is sleep apnea. And
Mhm.
I can tell you firsthand, I had a friend that had lost his brother due to sleep apnea. He was a former NFL
Yes.
player, big guy, and he died during the night with sleep
Yes.
apnea. And so it is a very, very serious condition that you have to pay attention to. Also, there's some great other comments coming in from the audience. They're engaged in this topic. Um, so financial worries was something that people said that keeps them up at night. Um,
Mhm.
Hot flashes.
hot flashes, yes, hot flashes.
Yeah.
We did a show on menopause recently, and they talked about the hot flashes. So so women, if you're going through perimenopause or menopause, those hot flashes can keep you up at night. Unfinished business, and we talked about that earlier. Just unfinished business, whether it's trauma or any other type of unfinished business, that those things could really keep you up at night. So, Dr. Ron, I got a
And
question for
men,
you.
going back to men having prostate problems,
Mm,
not being able to empty your bladder well, or not fully emptying,
yes.
and the prostate is enlarged, and you have to get up multiple times during the night. Even if it's like I could sleep all night long, but my body is waking me up because I got to go to the bathroom. So those are issues that can be dealt with, and you really need to bring up with your doctor. See your
Mm-hmm.
doctor.
And
Mm-hmm.
just to piggyback on that, if you're getting up in the middle of the night, men, check your prostate. Also, you might want to check your blood sugar because that is an early sign of
Mhm.
diabetes, and so you could be
Yes.
pre-diabetic by just
Yes.
getting up, going through the night. And so that,
Yes.
so please get your blood sugar checked and get your prostate checked if you're a man. If you're getting up in the middle of the night multiple times to go to the bathroom.
Mhm.
Absolutely. Those are such good points. I will also add, if you know, go back and pay attention to when you first started having trouble with your sleep. Sometimes people don't think about the fact that maybe they started a new medicine, and some medicines are activating. And
Mhm.
so, if you take, for instance, Prozac or Wellbutrin, and you take it at bedtime, darling, you're not going to sleep. If
Mhm.
have ADHD and you're taking ADHD meds, and let's say you're taking them twice a day, or you have the extended release version, then you may be prone to not be able to sleep. If you're on steroids, and people are on steroids for all kinds of reasons,
Mhm.
from fibromyalgia to COPD to different things,
Mhm.
steroids will definitely impact your sleep. And then
Right.
sometimes we had a lot of talk about pain. We have people who are on muscle relaxants, right?
Mhm.
And so they are taking these medicines that make them sleepy, like muscle relaxants or maybe beta blockers or something like that. And so they're tired all day long and they're taking these
Mhm.
little naps and then they're not able to sleep at night.
Right.
Oh, Brenda Allen said too much caffeine. Brenda, you are all
Mhm.
over my street right now, honey. Yes, you are. Yes, you are. And if you watch a show that I did, I think last week, I talked about uh, having so much caffeine that I went to the ER thinking I was having a heart attack, and in fact, it was from that caffeine. But if you were drinking caffeine after 2 p.m., you're much more at risk. I had somebody who came in saying,
Mhm.
I need some medicine for it. And what was happening was the caffeine is a diuretic. So he was up all night because he was peeing all night, and and he told me, listen, but I need you all to understand because we don't always have insight into how much caffeine we drink. So he
Right.
had a big Sonics cup. You guys know those big Sonic cups or whatever. I
Mhm.
asked him, how much caffeine do you drink? He said, none. And I noticed that big Sonic cup and I said, well, what's in there? He said, tea. And I said, that's caffeine. And in his mind, he thought caffeine was coffee. So when we say caffeine, we're talking about coffee, tea, Red Bull, all of that. And because he
Mhm.
was drinking three of those a day throughout
Oh.
the day, it was activating, and he had to use the bathroom all night. And when he came back, when I said cut down on that, he was willing to give me his wife instead of caffeine. But when he came back, family, he had lost weight and he was sleeping. So all of
Mhm.
those empty calories with that tea, gone, and he could sleep.
Right.
Yes, Brenda Allen, thank you for
I,
raising
I
that
bet
point.
it, I bet his blood pressure leveled out too, because that caffeine will give you spikes in your blood pressure, and that's not good either. That your heart rate can go up when you get all that caffeine in your system, and so
Right.
that's not good either. So yeah, we have to know what those caffeine, even chocolate's got caffeine in it. So
Hmm.
when you got your M&M habits that you get some caffeine. So you drinking coffee, eating M&Ms, do all the caffeine's hidden in a lot of different places. So you have to be careful
Right.
about that.
Now,
Yeah, that's almost doing
And
it.
on the I'm sorry.
I
Go
was going to
ahead.
say before I go to the next segment, and Sherry, I'll circle back to you.
Mhm.
But let me just recognize our amazing audience today, because we have people calling from Florence, Alabama, Little Rock, Arkansas. We got folks from Cape Town, South Africa, Nacogdoches, Texas, New Jersey, Pennsylvania. Family, you are in the house. We appreciate you as you hear us dropping your comments and dropping your questions, and we're definitely going to try and answer those as well. Now to you, Dr. Diamond.
Yeah, I was going to say on the flip side of that, you can also have hypersomnia,
Mm-hmm.
meaning you sleep too much.
Mm-hmm.
And as Dr. Maddox was talking, when she began to talk about medications, a lot of times those medications will cause you to be sleepy all the time. And, besides sleep, there is the issue of fatigue, and they kind of, they go hand in hand. And so, talk to your doctor if you start a new medication. Some meds will the effects of them will get better the longer you take it. It may be a temporary issue, but some are just known to just make people feel really tired. A lot of blood pressure medicines do that. And so, again, if you're napping a lot during the daytime, then that feeds into not sleeping well at nighttime, too. So, hypersomnia is also one of the symptoms of depression. So, sometimes we sleep, like I said, it's a coping mechanism, it's an escape, it's a healthy way to do, but if you're doing too much sleep, that can also be a problem.
Mm-hmm. Great points. And we had one other comment from Twanda Miller saying menopause. Yes, Twanda Miller, menopause. Yes, yes, yes. The hot flashes, but also just the feeling activated and more anxious.
Yes.
One of the things that I will say when we've talked a lot about some of the physical conditions or the physical issues, ranging from thyroid disorder to diabetes to chronic pain, perimenopausal, menopausal, those kinds of things. But I'll pivot just a little bit and talk about some of the mental health issues that
Mhm.
can impact. With post traumatic stress disorder, there can be a lot of nightmares. And so if people are having nightmares, it wakes them up, interrupts their sleep, and they may find it difficult to go back to sleep. Being paranoid with schizophrenia can have you up. Also, now we have a new thing where people think that it's completely safe to use marijuana. And so they have these different forms of cannabis. Them are activating and that kind of stuff. And of course, as we talked about, depression and then anxiety. If you're up all night worrying, okay, or you have OCD, and so you got to be up checking things. Those kinds of things can definitely play in. Now that we've talked about some of the things that can contribute to it, how do you get this assessed? If you have um, if you are having this prolonged time to where maybe you're only sleeping 1 or 2 hours a night or 3 or 4 hours a night, and you're not getting the full 7 to 8 hours a night that you want, when do you go to the doctor? And uh, for that, what triggers you to go? And then once you go, what can you expect to happen once you get there?
I would say one of the first things you need to do, and we talked about this on another show when we were talking about getting the most out of your doctor visits and such. So go
Mhm.
with the knowledge. You mentioned Dr. Maddox about trying to really pinpoint when it started. So when it started, what were the circumstances upon which it started? Sometimes I have people that aren't even thinking about certain traumas or say for instance deaths in the family that they had, or other just traumatic events, and the anniversary of it is coming up and things
Mhm.
like that. So sometimes it's very subtle, how sleep issues creep up, but pay attention to, things, the when, the where, the why, the how it got started. And then also go to going back to sleep hygiene. We've said that phrase a few times. What is sleep hygiene? Sleep hygiene is having a set time to go to bed every night. Sleep hygiene is not having your devices on. That blue light, some people say, well, I can't go to sleep unless the TV is on and things like that. It may actually be doing you um, worse to have the TV on, to have your phone attached to your hand, and all your
Mhm.
notifications on, so it's glowing every time something pops up. All those things can keep you awake at night.
Mhm.
Again, cutting the caffeine earlier in the afternoon. 1 or 2 in the afternoon is the latest you really need to be drinking caffeine. Okay. If you got to have coffee all day long, switch it to decaf after that. Your eating habits. This is
Ooh,
something
let's
Dr.
just
Max and I had talked
stay
about
there.
earlier. If you are eating a carbohydrate heavy diet, you will be sleepier during the day. You may feel like you need to nap during the day and then you don't sleep well at nighttime. So, watch, how you're eating. Eat for your performance, high protein, especially throughout the day so you don't feel sluggish
Mhm.
during the afternoon, for instance. But sleep hygiene. So set times, try to eliminate naps if you're trying to correct your sleep patterns. Try to
Hmm.
eliminate those naps. Make yourself stay up so that when it is time to go to bed, you're able to. Talk to your doctor if there are medications that you just can't get past. This affects work performance. I think I saw a figure of sleep disorders of costing job places about
Hmm.
$100 billion a year
Wow.
because people are absent or they're not performing well because they're tired during the day and they're not sleeping at nighttime. So, see your doctor
So,
about
doc,
getting medications
Dr. Dam,
changed.
Dr. Diamond, I'm gonna say it that the way you can't say it because you're a medical professional. If you get an itis after every time you eat, you eating the wrong stuff.
That part. That part. And
I'm
here's
just gonna set that right there and walk away.
yeah. Listen, but that is so important, and I wouldn't have said it like that. But we all know what we're talking about when we say that. If you can play spades and you know what red Kool Aid is, you know what he's talking about. And let me just say, dominoes too.
You really, but in all seriousness, though, you really should not be getting that sleepy and sluggish after every meal,
Mhm.
because that means you're either eating too much or you're eating the wrong things.
Hmm.
Food should not make you feel that way every single time. Now, there's going to be some times I'm gonna give you some grace, on some times where you eat your favorite meal, or you might indulge on weekend. But if it's like that every time you're eating, it means you're carb loading. You got too much
Mhm.
fatty foods in there, and it's slowing down your body's processes. This is why you're feeling sleepy. So you gotta stop that. Change your diet. Eat something lighter, healthier. That's going to make you feel clean and still gonna get the energy. Still gonna get all you need, the nutrients that you're gonna need, but you're not gonna have that heavy sluggish feeling every single time. So
Right.
I'm gonna just tell you some of the examples of the stuff that does me like that. Okay. So if I eat rice or pasta for lunch, it's gonna be a rough day for me. And I'd forgotten because I've really um, got in tune with, eating high protein morning and lunch. But I had a drug rep bring me some fried rice. Oh, family, it was rough on me the rest of the day. If I eat any kind of mashed potatoes or baked potatoes or any of that stuff at noon, it's going to be a rough day. So pay attention to how your body responds to food. Now, I want to circle
Mhm.
back. We started talking about sleep hygiene, but let me just talk a little bit about what you can expect when you go to the doctor's appointment. You're going to get a comprehensive history. Going
Mhm.
to likely do a complete blood count so we can see if you're anemic. Look at, make sure you don't have any endocrine abnormalities like thyroid conditions or diabetes or those kinds of things. And then we're going to try to figure out the timeline. Did this start after someone died? Did this happen after you got on a new medicine? Did this happen after you stopped the medicine? Are you now taking steroids? Those kinds of things. Are you in pain? I have three standard questions that I ask as a psychiatrist, and it is, are you worried? Um, are you up peeing? And are you in pain? And then I'll throw in another one. Are your thoughts racing? And I want to know what's the longest length of time that you've gone with only an hour or two. Because if you tell me 4 or 5 nights or a couple of weeks, then I'm going to be looking at, number one, are you on some recreational drugs like meth or caffeine, or, are any of my medicines contributing to you not sleeping? And then finally, do you have something like bipolar disorder or PTSD? Because bipolar disorder can definitely keep you up for long periods of time. And I don't want to scare you with some of these things, but I want you to know that there's certain medicines that I can give you as a psychiatrist that will flip your sleep. If you have bipolar disorder that's undiagnosed, and I give you Lexapro, Zoloft, um, Prozac, Wellbutrin, you may start to feel better for maybe a week or two or not, but shortly thereafter, likely you're going to notice that your mind is racing, that you can't shut your thoughts down, that you can't shut your brain down, that you feel like you're going 90 to nothing, irritable, cranky, moody, not sleeping, those kinds of things, because maybe I flipped you with an antidepressant. And really there was like a lingering undiagnosed, perhaps bipolar disorder or something that made you manic, like a thyroid condition. All right. And when you go to a primary care doc, they got 7 to 15 minutes with you. I got 30 minutes to an hour with you. So I'm going to pick that stuff up. All right. And I need to make sure we got that out there because this part is definitely
No,
there.
that's
I,
important because I know sometimes sometimes
yeah,
people can go into some people can go into the doctor's office and they start saying, well, let's look at your this, look at that, look at this, and you're like, I said I can't sleep, doc. Why are you looking at my thyroid? Why are you doing this all this other stuff? They're ruling out the if there's any biological
Right.
thing contributing to your inability to sleep. So that's the first thing they have to rule that out before they start talking about other things, right? So that's the process. So for people, so don't get mad at your doctor when they start doing blood work and start asking all these other questions about your physical. So the other thing we failed to mention is OCD, right? That's part of the it's an anxiety disorder, but when you start that's obsessive compulsive disorder, and that those obsessions can keep you up, right? If you constantly thinking that the door is not locked, if you constantly
Right.
thinking that the oven needs to be cleaned or the lights are on in the upstairs room, you're going to keep going to go check it. You're trying to satisfy that obsession, and that's going to keep you up. It's going to wake you up at night. Oh, I left the oven on. I left the light on. I left my curling iron plugged in. And that's going to bother you all night long, and you're not going to sleep properly. So OCD is a big contributor to a lack of sleep. It can be a contributor to a lack of sleep.
I wanted to add something as well, and it's kind of a pivot, but I think it's important. In our community, as minorities, as Black men and women, the chronic stress that we deal with from day to day, it just in our community, just at work, the things that we're dealing with. And, one thing that we've been taught is to be tough. You're not strong enough. You're not tough enough. Just take it or, just deal with it. But if dealing with it on your own has caused you to stay up all night, if you are getting, you're having anxiety, you're having so much stress because of everything that you deal with from day to day, those factors play into how well you sleep as well. So you may be thinking, I'm just dealing with life. I'm just this how I cope. I'm just going through life. But if it's affecting you in a negative way, you just doing things your way, that not getting that sleep and not taking care of yourself or dealing with chronic fatigue, that could be attributed to just your day-to-day things that you're dealing with. So you have to learn how to cope. We need coping skills to deal with our stress so that we can get that sleep.
Oh, that's good. And as you were talking about coping, one of the strategies that I will hear people talk about in order to get to sleep is having a glass of wine a night or smoking marijuana. Lord, I can't tell you how often I hear I smoke marijuana in order to get to sleep.
Right.
I will also hear about people taking benzos or different things. And let me tell you, while the short term fix, if you have a glass of wine, maybe to help you get to sleep, understand that alcohol disrupts your sleep architecture. And it also makes you have to go to the bathroom. So while you might get to sleep, you're gonna have to get up and use it, depending on how much you are you're taking. And understand that we have people like Michael Jackson, who's no longer with us because he was trying to go to sleep. Marilyn
Mhm.
Monroe, trying to go to different ones who did not realize the amount, because maybe they had a prescribed medicine, but if you're taking a prescribed medicine and you're taking it in a way that it was not prescribed and you're overdoing
Mhm.
it, if you have benzos and then you mix benzos with alcohol, that slows your breathing down. So let me
Mhm.
just tell you this: when you go to your doctor, if you know you're doing cocaine and meth and you going in there telling them you can't sleep, family, help us not kill you. Because if we don't know what you're doing and we mix some of what we know to be effective with some of the stuff that
Mhm.
we don't know you doing,
Right.
that's a recipe for disaster. So, and if you feel like you're judged when you tell your doctor you're doing coke, because I have people tell me all kind of stuff. But if you feel really judged and you feel like you can't get the treatment that you need, and you're in a metropolitan area, please look for a different doc and get recommendations from your friends who do drugs. Now, my best recommendation is for you not to do recreational drugs. But if you are
Right.
going to insist on doing it, find somebody that will hear you and that won't, judge you harshly. You know, well, you understand what I'm saying. You understand what I'm saying? Somebody you can talk to. Ellis, you look like you wanted to say something, and then you, Dr. Diamond.
Look, I'm gonna say this. Don't do math. How about that? Just let's just make
Or,
it. Let's just make it. Or
or
cocaine,
marijuana.
or any one of those any one of those stimulants. Um, in that, because they're two different buckets, right? So we understand that
Mhm.
meth and cocaine are those stimulants that are really going to get the heart racing, really going to keep you up. Marijuana is going to have a different impact, and you say, "Oh, it's going to help me sleep, and it's natural, and all sort of stuff." Because I've heard all the arguments. Okay, I've been in all the arguments. Over time, it's going to be detrimental, and we got a program coming up next week where we talk about using marijuana can kick off undiagnosed underlying mental illness, right? It can kick off schizophrenia. If you've got a family history of schizophrenia, you start using marijuana, it's in you. Marijuana could kick it off, and there's been a lot of people that have talked about it wasn't to their childhood they started using marijuana that they started having these feelings. And so you have to be really, really careful with using recreational drugs. I would say
Mhm.
alcohol, anything. Because I know we say, oh, well, I could eat heavy before I go to sleep because I get that itis and I just go straight to bed. No, if your body is digesting all that food and you're not burning energy, what is it going to do? It's going to convert all that energy that it just
Right.
digested. And it's going to convert it into fat because you're not eating it, and it's going to sit right there. And you're going to wonder why you continue to gain weight because you're eating heavy late at night. So let me take that off the table. So that's my sleep aid. I'm eating me a piece of cake and some ice cream and all kinds of crazy stuff. And then no, that's not a sleep aid, right?
Ellis is
And
messing me up right now. I'm about to have to leave you all and go get.
you're gonna come up to your house with a trash bag and just throw all that stuff out. The last thing I would say is this: be honest with your doctor. If you can't be honest with your
Mhm.
doctor, then you're right. You got the wrong doctor, right? Your job when you're going to you get your checkup to have your appointments is not to beat the doctor, right? And I know that. I mean, I understand that. And as a male, I was that dude. I would be eating healthy 2 or 3 days before I had to go to my doctor's because I want my blood work to look good. And then as soon as your blood work come back good and you go back to eat a bad way, you just you trick the doctor. But guess what? You're not tricking your body. You're not tricking
Mhm.
your heart. You're not tricking anything else. So please be honest with your doctor. Go in and tell them everything you're doing, even if it's illegal activity, because they are bound not to disclose it. They are bound by law not to disclose it.
Right.
So y'all can have a real honest conversation because you could lie your way to the grave, mess around with your doctor.
And I
And
want
I will say this. Oh, go ahead.
I
Oh,
was just
I was gonna say.
okay.
Good.
I'll say this: if you're pregnant and and your baby is born with meth or cocaine, in some states they're calling child protective services. So you do need
Mhm.
to understand that. So everything he
Mhm.
said, but in the context of your baby being born with drugs in their system, it's a problem. All right, Dr. Diamond.
Right. And I was going to say too, that one of the frustrating things is when someone comes into me and they don't want to make the changes. They're not
Mm,
going to stop using the drugs. They're not going to cut the caffeine. Everything is I need it, and then they want a medicine for me to give them a medicine to put on top of whatever it is that they're doing. It's not gonna happen. It's not gonna happen. We have to make the changes that are needed to be made. And the other thing too, when it comes to drugs like alcohol and benzodiazepines, and when we say that on the street, benzos, usually a popular one is Xanax. They call it bars. Clonazepam, Valium, things like that. That's what we're talking about with benzodiazepines. When you use those things, your body begins to build a tolerance to them, and you wind up needing more and higher doses to get the same effect. So don't use unhealthy coping mechanisms to deal with the sleep. Get to the root of the issue, and let your doctor help you fix those things. Don't the whole alcohol before bedtime? Yes, that is a big thing, and I know people do it, but at some point it's not going to work anymore. It might work for you for a little while, but it's not going to work anymore. And so, figure out the best way to really cope and to handle the issues that you're having. And sometimes our worries and things that we have, you maybe you got too much on your plate, and you need to learn how to start saying no to some stuff, so you don't have so much to put on that list. you know Maybe there's something about your physical health that you just have been ignoring and not taking care of, and it needs to, you need to do what you need to do to get it fixed and stop putting it
mhm.
off. Those,
Yeah.
sometimes there are things, very simple things that we can do that we just don't want to do, or we have an excuse, or we're worried about what somebody else might say. And all of this goes back to it messing up your restorative sleep that God has so blessed us with.
Yes. And I want to jump in while you're saying that and say many times when people are choosing alcohol or drugs, the three reasons they tell me they're doing that is sleep, to numb, to and to make it through, like to forget stuff. And when I hear that, particularly those last two, it means to me that you are trying to avoid dealing with some life issues that if you continue to deal with it by drugs or what have you, it's going to create bigger issues. And so that is a really good alarm and signal to you that you should see a therapist, a counselor, a mental health professional. And you will notice that I say a mental health, I'm going to say a licensed mental health professional, because many times, and I respect ministry, I respect your faith and all of that, but I need you to understand you can have faith in Jesus or faith in whatever your thing is. And all clergy are not don't have the same level of training, and that's
Right.
and they're not bound by the same things. If a psychiatrist or a mental health professional has sex with a patient, we can lose our license. We will be reprimanded. But when you are sharing your heart, there's a level of intimacy that can develop that can really go down a different path. And then also just know they're not trained, and many are not trained, don't have training requirements. And so you gonna get what you get or what they know, and it may not be the right thing. Now, family, Lord Jesus, we almost out of time, and we hadn't even talked about the medication side. Um,
Dr.
but
Maddox,
I'll make a summary. Yes, ma'am.
I got a quick just throw in there. What about melatonin? When these people are taking the melatonin vitamins and the gummies and things like that, do y'all have any feedback on that? Because I know a lot of people that take melatonin. He
I
just
take
moved on out
So
the way, didn't he?
so this is what I'm going to tell you. I definitely encourage people to take melatonin at times, but I am a huge advocate for getting to the root of the problem instead of addressing the fruit of the problem. So if you have a
Mhm.
long term insomnia, melatonin, it will help, but it's not getting to the root of it. So while you are using melatonin, also prioritize, am I, why is
Mhm.
this happening? Because if you have untreated sleep apnea, then, or if you have untreated diabetes or untreated thyroid conditions, and the longer they go undiagnosed, the more other organ damage is done in the long term. So definitely melatonin is okay, but understand you want to prioritize getting to the root of the issue and
Mhm.
understanding what the root cause of it is. Is it stress? Is it diabetes? Is it thyroid issues? Is it trauma? What is it? You're smoking at nighttime, and smoking nicotine activates, or what
Mhm.
have you. But get to the root of it. And yeah, so that's a great question. I love it. So I was going to wait. Now, on the sleep side, people will come in and say, I want, what are the sleep medicines, common sleep medicines folks want?
Ambien.
Ambien, that's number one.
Yeah.
Ambien.
What else? Trazodone. Um,
Trazodone, clonazepam, the benzos,
Yep.
clonazepam,
Yep.
alprazolam.
So they will
Yeah.
come in and say that they want certain sleep medicines, and understand that those sleep medicines are not without potential issues. You heard
Mhm.
about people who get on the Ambien, and maybe they're sleepwalking or sleep driving or sleep
Mhm.
doing something. Trazodone can impact your sex drive, fellas. Okay. And so it can contribute to erectile dysfunction, right? So you might be
Right.
getting sleep, but then other areas are lacking. Clonazepam,
That's the
some.
only thing you're gonna be doing is sleeping.
All right, all right. So, and then the other, now sometimes people will get annoyed with me when they come in and they want me to treat it, and instead what I say is, oh, you're on gabapentin 800 3 times a day. Talk with your primary care doc and see if you can cut out that 800 milligrams in the morning and dose it closer to the evening when you're supposed to sleep. So if you are
Mhm.
taking medicines that make you sleepy all day, talk to your primary care doc about, or whoever's prescribing, about if you can take those closer to the evening. I had a patient who did not follow my instructions. She was taking her Wellbutrin at night, and that's why she wasn't sleeping. So go in, ask your pharmacist, are any of these medicines activating that I'm taking before bedtime that can make me not sleep? ACE inhibitors, those kinds of things. Now, family, Lord Jesus, we are 6 minutes out before we're wrapping up. And this show could go on for another hour. And Ellis, I have not been checking the comments. So please, recently. So I will give, anything that you all wish you wanted to talk about that you didn't get a chance to say, or any resources or last minute tips that you want to give to our audience, who I might add has been fabulous, from Alabama to Cape Cod to Cape Town. We appreciate you all for tuning in. Christina, I will start with you because I don't think you got to talk very much today.
Y'all were doing all kinds of medical stuff. I'm like, let me sit back. The only thing I would add, especially to maybe give your doctor, is a sleep diary. So you're
Mm,
monitoring what your sleep patterns are, and that is easier for the doctor to see kind of what's going on.
mm.
Is that accurate, Dr. Diamond?
Yes, that's phenomenal. That's great.
Yes.
Yes.
Yes. A sleep diary is, yes, it's great. And along with that, tracking, what you're eating, any caffeine you're drinking, all those things play into doing a diary regarding your sleep. What happened during the day? you know
Mhm.
anything, whether it was something upsetting or whatever the case may be. So yes, it helps to come armed with that information, because when we're dealing with fatigue and sleep issues, it's such a huge gamut of diagnoses that may come about, that it helps to be able to narrow things down. And like Dr. Maddox emphasized, we don't get a lot of time to do that. And so, and then don't push back. I know sometimes people want their issues answered right away. They want, just give me something right now. Just, go ahead and, so I can leave and I can go home and I can get a good night's sleep. But let's do the work. Let's do the work that is required so that we get the most accurate diagnosis, so we can give you what is going to be most effective for your particular situation. There are so many things that play into fatigue and sleep disorders, that we don't we I could be with one patient all day long and still not get to to everything. So it does, yes, having a diary kind of helps narrow some things down.
Absolutely. And with that diary, if you're a woman of childbearing age who's still having cycles, do note when you're having cycles, because sometimes we will notice that people who just before their cycle starts, their sleep goes haywire. So those types of things are things you'd want to include as well. Now, to you,
Yes.
the all knowing, all amazing Ellis Dean, what say you?
Did I pay you set up? All right. Remember that commercial back in the day when they say there's an app for that? Well, there is an app for this, right? There's an app. There's an app that I use. It's called Shut Eye, and it you just turn it on when you're going to bed, and it tracks your sleep, right? And it tells you and it gives you a report of how you slept through the night. How long were you in REM sleep? How long you slept from start to finish? And you can set a timer when it tells you, when we're talking about keeping a good sleep diary, or a good, I forgot the word that we said earlier today, hygiene, good
Sleep
sleep hygiene.
hygiene.
Mhm.
This Shut Eye app will help you do that. There's also apps like Calm that will play those nice soothing sounds that'll help you get to sleep faster and sleep longer throughout the night. Helps. Some of them are designed to help slow the brain processes down. So if you have those anxiety, that mind racing, some of those noise, brown noise, white noise, they got all kind of noises that you can listen to that'll help calm your brain down so you can go to sleep. And so there is some technology that can help to assist you in that process. And then when you have to go see Dr. Diamond, you can say, well, here's my app. My Shut Eye app said for the last 3 weeks or 4 weeks, I've only been getting X number of per night, and then that's going to help her in that diagnosis. And so you can work with your doctor. There's times because you're not going to be with Dr. Diamond all the time. She can't do the sleep study for you. What you can do is help fill in that gap and give your doctor more data so they can get to a better diagnosis to help you sleep.
Mhm.
Absolutely. I love it. I love it. I love it. And Ellis, you raised a point that I can't believe I was on here with Christina Allen and we didn't get to. There is the first recommendation is cognitive behavioral therapy for insomnia. Now, depending on where you're located, it can be a challenge to find someone who is trained to do that. But there is CBT for insomnia, and that is probably one of the first recommendations for it. Now, I will tell you that when I recommended, people like, child, please, I want something today that's going to put me to sleep today. I don't want to do all that. So if, as I'm summarizing, what I'm going to tell you is sleep hygiene is important. I think Christina
Mhm.
started with that in the beginning, having a regular time, getting a routine, nice calming routine. Don't watch CSI, NCIS, Criminal Minds right before it's time for you to go to bed. Don't have the fight with your husband and stay up all night before it's time to go to bed, and then you up mad. If you're thinking about stuff, do a brain dump in your journal. Don't try not to be smoking and drinking tea and coffee, or you're gonna be up all night. And then when you go in, please have done your due diligence and write down as much as you can. Don't go in and talk about the Super Bowl. Start with what's really important first. And if they start getting some if they start asking to do lab work, they're not ignoring you. That's a part of the process. But think about when it started, and we want to, by all means, get to the root of it and not treat the fruit of it. Now, I want to just thank my audience has been absolutely phenomenal, and I want to take this time to shout out Mr. Myers, who said he lost 30 pounds tracking what he was eating and carrying on. That is really good. Yes, and we've missed you, Mr. Myers. Keep coming back and Sharma and different ones. Barbara, who frequent flyers. I appreciate my frequent flyers. I appreciate our generous guests who have come in and shared their time. And I just know I need you all to know you're fabulous. You're fantabulous. I appreciate you. Do lock me in. We will be on next week as well. Same time, same place, 11 a.m. to 12 p.m. Central Standard Time, 12 to 1. And between now and the time that I get back, Ellis, I'm going to be doing a show with Dr. Gigi. Can you tell our audience so that they can tune in for that show as it relates to cannabis and psychosis?
Yeah, so on Wednesday, that's this coming Wednesday, I believe that's the 19th at 8 p.m. on blackdoctor.org. We'll be doing a house call with Dr. Gigi, and Dr. Maddox will be there. And we're going to be talking about how cannabis use can ignite certain mental disorders, and so and how you have to be careful about that. So that's another plug for knowing your family history. Also, July is National Minority Mental Health Awareness Month, and so please, 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 if you're having any difficulty, if you're having some struggles, if you thought about getting counseling, do it this month. There are a number of sites that you can go find a black counselor. For women, there's therapy for black girls. You can go to the American Psychological Association. There's a lot of places where you can go that are available to you. But please, if you thought about it, and then, hey, look, it's okay if you go and say, you know what, I don't really need it. That's okay. But at least seek it out, talk to somebody, work through whatever issues you have, and that could impact and give you a good night's sleep just knowing you've unburdened yourself with what's going on in your mind. So please get
Yeah.
your mental health check this month.
And for those resources, if you go to my Facebook page at Dr. Rhonda Mattox, DrRhondaMattox, I have outlined a number of resources for information as well as how to get scheduled over there. So again, I want to thank my wonderful guests and my amazing audience for being so involved in this discussion. I will see you same time, same place next Thursday. Bye-bye.